Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schultz, physical therapist.
Brad Heineck, physical
Together,
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, I'm going to tell a story real quickly.
Oh, let's hear it, Bob.
Golfers are nuts. You know that.
Oh, well, of course. There's no doubt about it.
When they get attached to a sport like golf, they are crazy about it. And so I have a friend who loves golf, probably more than life itself.
Does this have anything to do with therapy, Bob?
Anyway, so last year, he actually had to stop golfing because of golfer's elbow. This year, we jumped on it right away. We'll show this.
Yep.
We used a massage gun before he would golf, and then when he was done golfing, we would use it. And he golfed all the way through the year.
So he was grateful.
I'm sure he was.
Yeah. So golfer's elbow, the medical term is medial epicondylitis.
Right.
Golfer's elbow is a lot easier to say, and most people are familiar with it.
You sound smarter than one. Say media.
That's a good point. Yeah, as long as you can, get it out and So the thing is, should we show it on Sam or should we just show it here? I think we could just show it here.
I think most people know where it is.
Yeah. So golfer, there's tennis elbow, which is on this side.
Right.
And then there's golfer's elbow, which is on the inside, if you will. And that's the medial. That's why it's medial epicondylitis. And that's the bone right there. These muscles here that are responsible for flexing your wrists, and also there's some for flexing your fingers. They all end up connecting at this bone.
The funny bone.
Yeah. Technically, I don't.
Right.
We'll call it the funny bone. It's right by your ulnar nerve, which is under here.
Right.
But now, if I get someone in the clinic and this is their diagnosis, I will kind of push around in here, and almost invariably when you get close to that bone, the most tender spot is right there.
That'll make them jump.
Yeah. They pull away. They don't touch it there. So the good news is there's some...
Haven't you had it too?
Yes.
Yeah.
It's been a while. I had more tennis elbow.
Yeah,
but the treatment's very similar. Yeah. So the good news is you can treat this at home. You don't have to go to a therapist or a doctor.
We have a lot of different tools.
Right.
And we're going to show you and figure out which one works for you.
Right.
And stick with that.
Yeah, because this can hang around for months if you don't treat it right, and it just continues to get irritated.
Right.
Yeah, exactly right. So people want to know what we're going to say.
Start off.
All right. So the first thing, I did want to say, usually it's from repetitive motion.
Right.
Or if you go do something like a weekend warrior thing and you stress that muscle for whatever reason.
You actually probably tear it.
Yeah.
Probably tear the tendon.
Yep.
Right.
So the first thing is avoid activities that irritate it.
Right.
If you can. The hardest thing are for people at work.
Right.
If it's a part of their job and you have to do this, whatever activity that irritates it. But we're going to show you a couple things that can help with that as well. So that's the first thing. The next thing is say you it's really tender and it's really inflamed. You can do ibuprofen, some NSAIDs, as long as you don't have any other meds that are going to irritate your stomach with it. NSAIDs, non-steroidal anti-inflammatory drugs.
Right.
There you go. And so it's like ibuprofen is a primary one across the counter that most people use. And then the other one, the old Mother Nature cold packs.
Right.
Now, you can take a cold pack like this, a gel one, pull it out of the freezer and wrap it around there. And then, you're going to hold it there.
Because they conform to
the elbow. Yep, that works really well. Now, for this particular injury, this is where I don't mind using a cold or ice cup. So you put water in a cup. You
freeze it.
Yeah, it's a cup that's either paper or styrofoam. Freeze it. Yeah. Make sure you freeze it.
Be a big problem.
Yep. So I had this in the freezer the last couple of nights. It comes out, and then you go like this.
I usually, to get ready, Brad, I smooth out a little bit with the other hand. I go a little bit of that.
Yeah, that does make it a little smoother.
It does, yeah.
It will get a little drippy, so have a towel ready. Now, the big advantage to this is it only takes 5 minutes.
Yeah.
Cold pack, you usually need 15, 20 minutes. And at first it hurts, and then you go through a burning phase where it's not real comfortable, but then it gets numb, and then it puts a smile on your face.
You can take 2 fingers, and if it feels like one, that means that the area has numbed up.
Yep. It feels like
Bless
2
you.
yet. I'm going to keep going. No, so that's a real nice option, particularly for golfer's elbow.
Yeah.
Now, the next thing you want to do is do a little massage, because these muscles oftentimes get tight.
Yes.
And when these muscles get tight, that puts more stress on the point of
And
injury.
that's what I found with my friend.
Yeah.
Is that, I mean, he would get this loosened up,
Yep.
ready for golf, and there was less stress on it then.
So how did he loosen it up?
I gave him a massage gun.
Oh, you did?
Yes.
So if you don't have a massage gun, you don't have to go out and buy one.
Right.
It is easier, but what you'll want to do, you don't have to put on a towel, or a pillow. It works better. Is you're going to work in these muscles. I find the thumb works better.
Works
Yep.
so good.
You can get in here
Especially
like
based
this.
on the location of it.
Yep. You're going to feel around on the muscle belly, and you're probably going to find a ropey spot.
Right.
And it's going to be a little tender. And
Like
that's
a trigger point quite
Yep.
often.
So that muscle's kind of knotted up. And
Right.
you need to get in deep. And, after about 30 seconds, you should feel it start to relax.
You know what I've been reading, Brad, is that quite often they think the knots may be caused by the fascia now.
Oh, the fascia.
Yeah, the tough fibrous material that surrounds the muscle.
Right.
So, but eventually you want to work your way up to the actual
Yep.
elbow, and you want to do a little bit different massage there.
The
We're gonna do
cross fiber. Right.
massage there.
So-
And you probably won't be able to tolerate that at the start.
Right. After it improves, and maybe a few days, you get up in here, and the fibers run this way. You're going to go back and forth
Of the
this
tendon.
way. Yes.
Uh,
Yep.
uh, right.
And you're going to back and forth this way. And after about 20, 30 seconds, if the pain relieves and starts to feel better, or kind of a numbish feeling, then you're going to work on this for probably about 3 to 5 minutes
Right.
until your thumb gets sore.
If it gets worse, it's too early.
Right.
I
Yep.
mean,
you
if
need to
do it
back
for
up.
20, 30 seconds and it still really hurts.
Yeah, it's
It's
tender.
too much.
Get back up in the muscle belly, work that. Again, see, I'm already starting to get
It's
a little
to
tired
help
hand.
break up the scar tissue that's in the tendon.
Yep,
So,
yep. So let's talk about, if you don't want to irritate your thumb or your
Right.
hand, you can use a massage gun.
right.
If you have one. Which one are you going to pick,
I don't
Bob?
know, I'll grab this one.
Sure. I'm
Uh,
gonna grab the smaller one, which is one of my favorites.
Now, Brad really came up with a good way to use the round head on these. And this was the round head. He doesn't go directly into the muscle like this because it'll bounce off.
Yep,
He actually, especially if you're going to do it on the tendon,
yep.
he goes from the side like
Yeah,
this.
Turn it sideways.
And just some good cross fiber massage that way.
Yep,
Now, going down to the muscle, you can actually go like that.
yep. When you get up in here, but as you get closer to that sore spot, turn it sideways
Yeah.
like this and work at it. And boy, I tell you what, it really makes a difference on your hands. You don't get sore thumbs.
Right.
And then, this you can time. You probably don't need to go more than 5 minutes with this. And, you're going to loosen up those muscles. It's going to create more circulation, get things relaxed, and allow you to return to your activity sooner. Now, there's a couple other tricks we want to show you. The next one is
Some K-tape.
Yep,
Kinesio
Kinesio taping. We got this from John Gibbons. He's got a book,
Right.
and he has all the parts in this book. The cool thing about what he did was, if you Google, put John Gibbons, and then put golfer's elbow,
Golfer's elbow, yeah.
his video will
Right.
pop up, and
And
he'll
he
show
does
you
a
how to
better
do it.
job than we do of
Yeah,
explaining
yeah,
how to
he's
do
an
it.
expert at it.
He's done it for years
Yeah.
and years and years.
I'm going to show you how he recommends to do that. You're going to take, you don't have to have 2 different color tapes. I'm just using that because so you can see what I'm doing. You pronate or supinate your hand. You put this right
Palm up.
over that sore spot, and then you do not put much stretch on it. See, because this tape stretches quite a bit.
Right.
You just get the slack out and hardly any stretch, and you go it like this, like that, okay? Then you take this.
You heat that one up yet or not?
I'm going to do it at the same time. I
Okay.
probably should do it separately, but for time, we can talk about that. The neat thing about this is you don't have to sit there and try and
Right.
separate it. You just rip it. It stretches, and that works really nice once you figure it out. It's kind of fun. Now this one, I cut a tail on it like this.
Right.
Right down the middle, round the edges. He'll talk about that in the video. Put that there, and then I'm going to just pull it across like that. But on this, you're going to pull. You stretch it 100% of the way, then back off to about 75%, and then put
So
that
you
down.
back off about 25%,
Yep.
and you leave 75%
Yep.
of the stretch
50
there.
to 75%.
Sure.
You know, it's kind of one of those judgment things,
Right.
but you need some stretch on the second one. And then you back off there. Then you save the paper and you rub on it for 30 seconds so it sticks to your skin
And
better.
this will be good for what, 2 or 3 days?
Yep. Typically, as long as you don't pick at it or get really sweaty or
You can
wash it with a
actually
lot of
shower
soap.
on it.
Yep.
I mean,
Now, like Bob said, I should rub this down when I put the black layer on
Right.
and then do it again. So you're going to have to set it 2 different times to get the maximum. Make sure your skin's really clean.
it's not a miracle worker, but it does help.
Yeah, this is one of those things. If you work with and your work
Yes.
irritates it,
You're
it's gonna
forced.
it's gonna help
Right.
throughout the day. Make your day go a little bit better. And no, there's one more. This is a really neat
Right.
trick. This
This stuff works.
Yeah.
I'm surprised at it.
you know, I've had it work, and we've had people comment on on a comment section. All you do is get a pillow right here, or you do this lying down on your back in bed. You bend your elbow like this, gently flex your wrist and your fingers gently.
This is a strain counter strain technique.
Exactly. And then you rotate your wrist right or left, whichever direction makes the sore spot feel better. So flex, flex, rotate till you get to the most comfortable position. When you feel it comfortable, completely relax. Don't have the kids running and jumping on you or the dog. And for 90 seconds, you have to time it.
Sure.
You have to relax for 90 seconds.
At least 90.
Yep. They say 90 to 120 seconds, up to
Sure.
2 minutes. And then when you get done with that, slowly extend things
Release it.
open. Yep. And don't do anything aggressive for like the next hour after that. You can do a little you can get the massage gun out, or you just do a gentle massage on it. And you'll find out that that can be a really nice way. I'm not going to get into the details about strain, counter strain, but it's really easy to do. And you'll notice it right away when you get done and it feels better. It's done the right thing.
It's like you could do it a couple hours before golf.
Sure.
You know,
Yep.
just to calm it down.
Exactly.
And be ready for the event.
Right. Exactly. Yeah. You can do that if you have success with it. You can do that, several times a day.
Right.
Yep.
Right.
So wonderful, Bob.
Yeah.
This is all the tricks we're going to give today.
Thank
Maybe
you.
on another video we'll be more
You
generous.
did well, Brad. You did well.
Thank
So,
you, Bob.
Thanks
For the help, and
thanks for
be
everybody coming to the show.
right, and be careful when you're golfing with that golfer's elbow.